Welcome to our series on kitten vaccinations. In this chapter, we'll cover everything you need to know to start your kitten's vaccination journey. Vaccinations are one of the most important aspects of kitten care, and understanding how they work will help you keep your new furry friends safe, healthy, and happy. Whether this is your first kitten or you've raised cats before, it's never too late to learn the fundamentals of proper vaccination care. Kittens are born with very limited immunity. At birth, their immune system is still developing, and they rely primarily on the antibodies they receive from their mother's milk, particularly the first milk known as colostrum. Colostrum is rich in antibodies that provide temporary protection against many diseases. However, this natural protection fades over the first few weeks of life, usually around 6 to 8 weeks old. This means that young kittens are highly vulnerable to infections if they don't receive vaccinations at the proper time. Vaccinations work by training a kitten's immune system to recognize and fight off certain viruses and bacteria. Essentially, a vaccine introduces a harmless part of a virus or bacteria to the immune system. The kitten's body then produces antibodies that remember the infection. Later, if the kitten is exposed to the real disease, the immune system is prepared to respond quickly, preventing serious illness. There are several serious diseases that vaccines can prevent. Some of the most important ones include feline panleukopenia, feline herpes virus, calicivirus, and rabies. Feline panleukopenia, also called feline distemper, is highly contagious and can be fatal. It attacks a kitten's gastrointestinal system, leading to severe vomiting, diarrhea, dehydration, and sometimes death. Feline herpes virus and calicivirus are among the main causes of respiratory infections in cats. Symptoms may include sneezing, runny nose, eye discharge, and mouth ulcers. These illnesses can be especially severe in kittens because their immune systems are still developing. Rabies is a deadly virus that affects the nervous system. It is transmissible to humans and other animals, making vaccination against rabies both a legal requirement and a health necessity in many parts of the United States. Most veterinarians recommend starting vaccinations when kittens are around 6 to 8 weeks old. The vaccination process usually involves a series of shots over several weeks, often repeated every 3 to 4 weeks until the kitten reaches about 16 weeks of age. This ensures that the kitten develops strong immunity. Missing a dose or delaying vaccines can leave your kitten vulnerable, so it is very important to follow your veterinarian's schedule closely. Vaccinations not only protect your individual kitten, but also help prevent the spread of disease in the broader cat community. This concept is known as herd immunity. By vaccinating your kitten, you reduce the risk of contagious diseases spreading to other cats, whether they are pets, strays, or community cats. Herd immunity is particularly important in shelters, multi-cat households, and areas with high numbers of outdoor cats. Before starting vaccinations, it's essential to ensure that your kitten is healthy. A veterinarian will perform a full health check to rule out any infections, parasites, or underlying health conditions. Vaccinating a sick kitten is generally not recommended, as illness can reduce the effectiveness of vaccines. A healthy kitten is more likely to develop strong immunity and recover quickly if exposed to disease in the future. Vaccinations are generally safe, but it is normal for kittens to experience mild side effects. Some kittens may have a slight fever, feel a bit tired, or have mild soreness at the injection site. These effects usually resolve within a day or two. Rarely, a kitten may have a more serious reaction, such as swelling, vomiting, or difficulty breathing. Always monitor your kitten after a vaccination and contact your veterinarian if anything unusual occurs. In addition to vaccinations, overall kitten care plays a significant role in supporting their immune system. Proper nutrition is essential. High-quality kitten food provides the necessary vitamins, minerals, and proteins to support growth and immunity. Socialization is also important. Kittens who are exposed to gentle handling, other pets, and different environments tend to cope better with stress, which indirectly supports their health. Parasite prevention, such as flea, tick, and worm control, is another crucial factor in keeping kittens healthy and ensuring vaccines work effectively. Some kitten parents worry that vaccinations are unnecessary or that natural immunity is enough. While kittens can fight off minor illnesses, vaccines provide targeted protection against serious and potentially fatal diseases. Choosing not to vaccinate your kitten puts them at risk for illness, and it may also expose other cats in your household or neighborhood to disease. Vaccinations are a small step with long-term benefits, not only for your kitten but also for the larger cat community. It is also important to keep a record of all vaccinations. Most veterinarians provide a vaccination card or digital record showing the type of vaccine, the date administered, and when the next dose is due. Keeping these records organized helps you stay on track with boosters and ensures that your kitten's protection remains strong throughout their life. By the end of this series, you will have a thorough understanding of kitten vaccinations, including which vaccines are essential, how to administer them safely, and what to expect during the vaccination process. Knowledge is power, and understanding how vaccinations work empowers you to make the best decisions for your kitten's health. In the next chapter, we will go into detail about core vaccines for kittens. We'll discuss what each vaccine protects against, the timing of each shot, and tips for reducing stress during vaccinations. Understanding these vaccines will give you confidence in protecting your kitten against preventable diseases and ensure they have the best start in life. Welcome to Chapter 2 of our series on kitten vaccinations. In this chapter, we'll take a closer look at the core vaccines for kittens, explaining what each one protects against, why it is important, and how often it should be administered. Understanding core vaccines is essential for every kitten parent because these vaccines protect against some of the most serious and potentially fatal diseases that can affect young cats. When we talk about core vaccines, we are referring to vaccines that are considered essential for all kittens, regardless of their lifestyle, environment, or location. These vaccines provide protection against diseases that are highly contagious, can spread rapidly among cats, and often have serious or fatal consequences. The core vaccines for kittens typically include feline panleukopenia vaccine, FPV, feline herpes virus vaccine, FHV1, feline calicivirus vaccine, FCV, rabies vaccine. Let's discuss each of these vaccines in detail. 1. Feline panleukopenia vaccine, FPV. Feline panleukopenia, often called feline distemper, is one of the most severe diseases a kitten can face. It is caused by a highly contagious virus that attacks a kitten's immune system and rapidly dividing cells, particularly in the gastrointestinal tract and bone marrow. Symptoms include severe vomiting, diarrhea, dehydration, lethargy, and loss of appetite. In young kittens, the disease can be fatal. The FPV vaccine is typically administered as part of a combination vaccine, often called the FVRCP vaccine, feline viral rhinotracheitis, calicivirus, and panleukopenia. Kittens usually receive their first FPV shot at 6 to 8 weeks of age, followed by booster shots every 3 to 4 weeks until they are around 16 weeks old. A booster is then given 1 year later, followed by boosters every 3 years, depending on the vaccine type and your veterinarian's recommendations. FPV is highly contagious and can survive in the environment for months, so vaccination is critical to protect kittens, especially those who may come into contact with other cats or spend time outdoors. 2. Feline herpes virus vaccine, FHV1. Feline herpes virus type 1 causes feline viral rhinotracheitis, a respiratory infection that affects a kitten's nose, throat, and eyes. Symptoms may include sneezing, nasal congestion, watery eyes, eye ulcers, and sometimes fever. While the infection is rarely fatal in healthy kittens, it can cause significant discomfort and long-term issues, especially in kittens with weakened immune systems. Vaccination against FHV1 helps kittens build immunity, reducing the severity of symptoms if they are exposed to the virus. The vaccine is usually given as part of the FVRCP combination vaccine. Like FPV, the FHV1 vaccine is administered in a series of doses starting at 6 to 8 weeks, repeated every 3 to 4 weeks, and concluded at around 16 weeks of age. It's important to note that while the vaccine greatly reduces the risk and severity of infection, it does not always prevent the virus entirely. Some vaccinated cats may still carry the virus or show mild symptoms, but they are much less likely to develop severe disease. 3. Feline calicivirus vaccine, FCV. Feline calicivirus is another major cause of respiratory infections in kittens and cats. Like herpes virus, it affects the respiratory tract but can also cause mouth ulcers, joint pain, and in some cases, more severe systemic illness. FCV is highly contagious among cats, spreading through direct contact, shared food bowls, and contaminated surfaces. The FCV vaccine is also part of the FVRCP combination vaccine. The vaccination schedule mirrors that of FPV and FHV1, starting at 6 to 8 weeks, followed by boosters every 3 to 4 weeks until 16 weeks, and then a 1-year booster. Vaccination helps prevent serious illness and reduces the severity of symptoms if a kitten does get exposed to the virus. Because calicivirus can mutate into different strains, some kittens may still get mild infections even after vaccination. However, the vaccine significantly lowers the risk of severe disease and protects your kitten's overall health. 4. Rabies vaccine. Rabies is a deadly virus that affects the nervous system of both animals and humans. While core vaccines like FVRCP focus on feline-specific viruses, rabies vaccination is legally required in many U.S. states for kittens and cats. Rabies is transmitted through bites from infected animals and is almost always fatal once symptoms appear, making prevention through vaccination essential. The rabies vaccine is typically given at 12 to 16 weeks of age, depending on local laws and veterinary recommendations. A booster is then required 1 year later, followed by additional boosters every 1 to 3 years, depending on the vaccine type. Vaccinating your kitten against rabies not only protects your kitten but also ensures the safety of your household, neighbors, and community. Understanding combination vaccines. Many veterinarians use combination vaccines, like the FVRCP shot, to minimize the number of injections a kitten receives. This combination includes protection against feline viral rhinotracheitis, FHV1, calicivirus, FCV, and panleukopenia, FPV, in a single shot. Combination vaccines are safe, effective, and reduce stress for both kittens and their owners. Side effects and safety. Core vaccines are generally safe, but it's normal for kittens to experience mild side effects, such as temporary soreness or swelling at the injection site, slight fever, mild lethargy or decreased appetite. These symptoms usually resolve within a day or two. Serious reactions are very rare but can include vomiting, diarrhea, or difficulty breathing. Always monitor your kitten after vaccinations and contact your veterinarian if you notice any unusual symptoms. Timing and follow-up. It is crucial to follow your veterinarian's recommended vaccination schedule. Proper timing ensures that your kitten develops strong, long-lasting immunity. Skipping doses, delaying vaccines, or giving vaccines too early can reduce effectiveness and leave your kitten vulnerable to serious diseases. Additionally, keeping a vaccination record is essential. Most veterinarians provide a card or digital record detailing the vaccine type, date administered, and next due date. This helps you stay organized and ensures your kitten remains protected throughout life. The importance of early vaccination. Starting vaccinations early is not just about protection, it's about giving your kitten the best start in life. Young kittens are curious, energetic, and prone to exploring new environments. Early vaccination ensures that your kitten can safely socialize, attend veterinary checkups, or even interact with other pets without unnecessary risk. Vaccines are a cornerstone of responsible kitten ownership. They protect your kitten from life-threatening diseases, support their overall health, and give you peace of mind knowing you are doing everything possible to safeguard their future. By the end of this chapter, you should understand what the core vaccines are, why each is important, the recommended timing, and how to care for your kitten during the vaccination process. In the next chapter, we will explore non-core vaccines. These are optional but recommended for kittens at higher risk due to lifestyle, environment, or travel. Knowing about non-core vaccines will help you make fully informed decisions about your kitten's health and protection. Welcome to Chapter 3 of our Kitten Vaccination series. In this chapter, we'll explore non-core vaccines, which are vaccines recommended only for kittens at risk due to lifestyle, environment, or specific health conditions. We'll also discuss special considerations for kitten vaccination, including travel, multi-cat households, and pre-existing health issues. Understanding these vaccines and considerations ensures that you can make informed decisions to keep your kitten safe and healthy. What are non-core vaccines? Unlike core vaccines, which every kitten needs, non-core vaccines are given based on individual risk factors. These vaccines protect against diseases that may be uncommon or only pose a threat under certain circumstances. Your veterinarian will assess your kitten's environment, lifestyle, and potential exposure to determine whether non-core vaccines are necessary. Some of the most common non-core vaccines for kittens include feline leukemia virus, FALV, vaccine, feline immunodeficiency virus, FIV, vaccine, chlamydia felis vaccine, bordetella vaccine. Let's discuss each of these in detail. 1. Feline leukemia virus, FALV, vaccine. Feline leukemia virus, or FALV, is a serious and potentially fatal disease that affects a cat's immune system and blood-forming cells. It is highly contagious among cats, especially through close contact such as grooming, sharing food bowls, or fighting. Kittens are particularly susceptible because their immune systems are still developing. Symptoms of FALV infection may include lethargy or weakness, loss of appetite, weight loss, fever, persistent infections, anemia. Unfortunately, once a cat is infected with FALV, there is no cure, which makes vaccination the most effective prevention. The FALV vaccine is typically recommended for kittens who spend time outdoors or have access to stray cats, live in multi-cat households where FALV status is unknown, attend boarding facilities, shows, or shelters. The vaccination schedule usually begins at 8 weeks of age, followed by a booster 3 to 4 weeks later. Your veterinarian may recommend annual boosters depending on your kitten's risk factors. Before vaccinating, a simple blood test can determine if your kitten is already infected, as the vaccine will not help an already infected cat. 2. Feline immunodeficiency virus, FIV, vaccine. Feline immunodeficiency virus, FIV, is sometimes compared to HIV in humans. It affects a cat's immune system, leaving them more susceptible to other infections and illnesses. FIV is primarily transmitted through bite wounds, making outdoor cats and those in multi-cat households at higher risk. The FIV vaccine is not considered essential for all kittens, but it may be recommended for those at higher risk. Vaccination typically starts at 8 to 9 weeks of age, followed by additional doses as directed by your veterinarian. It is important to note that the FIV vaccine may interfere with certain blood tests, so careful record keeping is essential. 3. Chlamydia felis vaccine. Chlamydia felis is a bacterial infection that primarily affects a kitten's eyes, causing conjunctivitis, or pink eye, and sometimes mild respiratory symptoms. While not typically life-threatening, it can be uncomfortable for kittens and highly contagious among cats in close quarters. The chlamydia vaccine is considered non-core, and veterinarians usually recommend it only for kittens who live in shelters or catteries, are exposed to many other cats, have a history of eye infections in the household. The vaccine is usually given in a series of 2 doses, starting at 9 to 10 weeks of age, with a booster 3 to 4 weeks later. 4. Bordetella vaccine. Bordetella bronchoseptica is a bacterial infection that can cause respiratory disease in cats, similar to a kennel cough in dogs. While often mild in healthy kittens, it can be severe in kittens with weakened immune systems or those living in crowded environments. The Bordetella vaccine is recommended primarily for kittens who attend boarding facilities or shelters, participate in shows, live with other cats in close quarters. The vaccine is usually given as a single dose, often intranasally or by injection, depending on your veterinarian's recommendation. Special considerations for kitten vaccinations. Vaccinating kittens is not always straightforward. Several factors can affect the timing, type, and effectiveness of vaccines. Let's look at some of these important considerations. 1. Travel and relocation. If you plan to travel with your kitten or relocate to a new area, certain vaccines may be required by law or recommended to prevent exposure to local diseases. For example, rabies vaccination is required for most travel within and outside the United States. FALV testing and vaccination may be advised if your kitten will be around other cats in boarding or shelter environments. Proof of vaccination may be necessary for airline travel or boarding facilities, so keeping an organized vaccination record is critical. 2. Multi-cat households. Living with multiple cats increases the risk of disease transmission, particularly for contagious viruses like FALV, FIV, and respiratory infections. Vaccinations become even more important in these households. Your veterinarian may recommend additional boosters or non-core vaccines based on your kitten's risk level. 3. Health conditions and immune system considerations. Kittens with pre-existing health conditions, such as chronic illness or congenital immune deficiencies, may require a modified vaccination schedule. In some cases, certain vaccines may be delayed until the kitten is healthy enough to respond effectively. Vaccination decisions should always be made in consultation with a veterinarian who can assess your kitten's overall health, environment, and potential risks. 4. Monitoring after vaccination. Just like with core vaccines, non-core vaccines can cause mild side effects, including soreness at the injection site, mild fever, lethargy, reduced appetite. Severe reactions are rare but possible. Always monitor your kitten closely for 24 to 48 hours after vaccination, and contact your veterinarian if you notice anything unusual. 5. Vaccination records and planning. Keeping detailed vaccination records is essential for both core and non-core vaccines. Your record should include vaccine type, date administered, next due date, any adverse reactions. An organized record ensures your kitten stays protected and makes visits to the veterinarian, boarding facilities, or travel documentation much easier. Making informed decisions. Non-core vaccines are not necessary for every kitten, but they are important for kittens at risk of exposure to certain diseases. Discuss your kitten's environment, lifestyle, and potential exposure with your veterinarian. Together, you can develop a personalized vaccination plan that maximizes protection while minimizing stress and unnecessary shots. Vaccinations are one of the most powerful tools you have to protect your kitten from preventable diseases. They not only protect your kitten's health, but also help safeguard other cats and even humans in the household. Understanding both core and non-core vaccines allows you to make thoughtful decisions that ensure your kitten grows into a healthy, happy adult cat. By the end of this chapter, you should understand the non-core vaccines available, when they may be recommended, and the special considerations that can affect your kitten's vaccination plan. In the next chapter, we will explore how to care for your kitten before, during, and after vaccinations, including tips for reducing stress, managing side effects, and ensuring long-term immunity. Welcome to Chapter 4 of our Kitten Vaccination series. In this chapter, we'll discuss everything you need to know to prepare your kitten for vaccinations. Vaccinations are a critical step in ensuring your kitten's long-term health, but the experience can be stressful for both kittens and their owners. Proper preparation can make the process smoother, reduce anxiety, and help your kitten respond better to vaccines. 1. Understanding the vaccination process. Before taking your kitten to the veterinarian, it's important to understand what happens during a vaccination appointment. Typically, the process includes a health checkup to ensure your kitten is healthy enough for vaccination, administration of the vaccine, either via injection or nasal spray, depending on the type, observation for any immediate reactions after the vaccine. Knowing what to expect can help you stay calm, which in turn helps your kitten feel more secure. Kittens often pick up on your emotions, so maintaining a calm and reassuring presence is key. 2. Schedule a pre-vaccination checkup. Before your kitten receives any vaccines, a thorough health examination is essential. During this checkup, your veterinarian will examine your kitten's overall health, check for parasites, infections, or underlying health conditions, assess weight, growth, and development, provide guidance on nutrition, socialization, and general care. Vaccinating a sick kitten can reduce the effectiveness of the vaccine and, in some cases, may not be recommended until your kitten recovers. By scheduling a pre-vaccination checkup, you ensure your kitten is in the best possible health to respond to vaccines. 3. Ensure proper nutrition. A kitten's immune system is supported by proper nutrition. Feeding a high-quality, age-appropriate kitten food helps strengthen the immune system, promote healthy growth and development, reduce stress, and improve overall resilience. Malnourished kittens may have a weaker immune response, which can make vaccines less effective. Providing balanced nutrition is one of the simplest and most important steps you can take to prepare your kitten for vaccinations. 4. Create a calm environment. Kittens can be easily stressed by new experiences, unfamiliar people, and travel. Preparing a calm environment before the vaccination visit can make a significant difference. Carrier familiarization. Introduce your kitten to their carrier several days before the appointment. Place soft bedding, toys, or treats inside to make it a positive space. Quiet time. Avoid loud noises, sudden movements, or other pets that may frighten your kitten before leaving for the vet. Comfort items. Bringing a familiar blanket or toy can provide reassurance during travel. Reducing stress helps your kitten stay calm, which may also reduce mild side effects like lethargy or loss of appetite after the vaccine. 5. Practice gentle handling. Vaccinations involve touching your kitten in ways they may not be used to, such as feeling their limbs for injections, examining their ears, mouth, and eyes, holding them securely during the procedure. Practicing gentle handling at home can help your kitten get used to being touched and restrained. This preparation makes the vet visit less stressful and ensures that your kitten is more comfortable with the process. 6. Plan the travel to the vet. Traveling to the veterinarian can be a source of anxiety for kittens. Here are some tips for a smooth journey. Use a secure carrier. Always transport your kitten in a safe, well-ventilated carrier. Avoid open carriers where the kitten could escape. Short practice trips. Take your kitten on short car rides before the appointment to get them accustomed to movement and sounds. Calming aids. Pheromone sprays or calming blankets can help reduce stress during travel. Avoid feeding immediately before the trip. To prevent nausea or vomiting during car rides, avoid feeding your kitten within 1 to 2 hours before leaving. 7. Prepare mentally for possible reactions. While most kittens handle vaccines well, mild reactions are normal. Preparing yourself mentally for these possibilities helps you respond calmly. Common reactions include mild fever or lethargy, slight soreness at the injection site, temporary decreased appetite. Rare reactions, such as vomiting, swelling, or difficulty breathing, require immediate veterinary attention. By understanding what is normal versus what requires concern, you can confidently monitor your kitten after vaccination. 8. Have comfort measures ready. After the vaccination, your kitten may experience mild discomfort. You can prepare in advance to make them more comfortable. Soft bedding. Create a cozy, quiet space where your kitten can rest. Hydration. Ensure fresh water is always available. Gentle attention, petting, soft talking, and reassurance help your kitten feel safe. Monitor appetite. Offer their usual food at regular intervals to encourage eating. These small steps can make a big difference in helping your kitten recover quickly and feel secure. 9. Keep vaccination records organized. Proper record keeping is essential for ongoing kitten care. A vaccination record should include vaccine type and manufacturer, date administered, next scheduled dose, any side effects observed. Digital records, photos, or a printed vaccination card can all be used. Organized records make follow-up appointments easier and provide proof of vaccination if your kitten goes to boarding facilities or travels. 10. Discuss individual risks with your veterinarian. Every kitten is unique, and vaccination plans should be tailored accordingly. Discuss the following with your veterinarian. Lifestyle risks. Indoor-only kittens may have different needs compared to kittens with outdoor access. Multi-cat households. Consider additional vaccines for kittens living with other cats. Health history. Kittens with chronic illnesses or previous reactions may need adjusted schedules. Travel or relocation. Additional vaccines or boosters may be required for travel. By personalizing the vaccination plan, you ensure that your kitten receives optimal protection without unnecessary vaccines. Summary. Preparing your kitten for vaccinations is just as important as the vaccines themselves. By ensuring your kitten is healthy, well-nourished, calm, and accustomed to gentle handling, you increase the effectiveness of vaccines and reduce stress for both you and your kitten. A smooth vaccination experience sets the stage for ongoing health, strong immunity, and positive experiences at the veterinarian throughout your kitten's life. In the next chapter, we will discuss post-vaccination care and monitoring, including signs to watch for, ways to manage mild side effects, and when to seek veterinary help. This information will help you confidently care for your kitten after each vaccine, ensuring their safety and comfort. Welcome to Chapter 5 of our Kitten Vaccination series. In this chapter, we'll focus on post-vaccination care and monitoring, which is just as important as preparing for the vaccine itself. Proper care after vaccination ensures your kitten recovers comfortably, helps you identify normal reactions versus potential problems, and supports long-term immunity. 1. Understanding normal post-vaccination reactions. After receiving a vaccine, it is normal for kittens to experience mild, temporary reactions. These reactions are usually harmless and a sign that the immune system is responding to the vaccine. Common mild reactions include mild lethargy. Your kitten may sleep more than usual for a day or two. Slight fever. A small increase in body temperature is normal as the immune system activates. Reduced appetite. Some kittens may eat less for a short period. Soreness or swelling at the injection site. This can occur with injectable vaccines. Mild sneezing or nasal discharge, occasionally observed with nasal vaccines. These symptoms typically resolve within 24 to 48 hours. Providing a quiet, comfortable environment during this time helps your kitten recover faster. 2. Immediate observation after vaccination. Many veterinarians recommend observing your kitten for at least 15 to 30 minutes at the clinic after vaccination. This helps detect rare but serious reactions immediately, such as anaphylactic reactions. Signs include swelling of the face or throat, difficulty breathing, vomiting, or collapse. Severe vomiting or diarrhea. High fever lasting more than 24 hours. If any of these severe symptoms occur, seek immediate veterinary attention. Prompt intervention can be life-saving in rare cases. 3. Creating a comfortable recovery space. After returning home, it's important to provide a calm and cozy area for your kitten. Soft bedding, a warm, quiet spot helps your kitten rest comfortably. Limited activity. Avoid rough play or interactions with other pets for a few hours to prevent stress. Access to water and food. Offer fresh water and normal food, even if your kitten's appetite is slightly reduced. Small, frequent meals may be easier for sensitive kittens. Quiet environment. Minimize loud noises, sudden movements, or other stressors. A comfortable recovery space supports your kitten's immune system and reduces anxiety after vaccination. 4. Monitoring for mild side effects. Keeping a close eye on your kitten helps differentiate between normal reactions and signs of complications. Track the following for 24 to 48 hours. Activity level. Eating and drinking habits. Temperature, if you can safely measure it. Injection site appearance. Mild swelling, slight redness, or tenderness at the injection site is normal. However, swelling that increases, spreads, or becomes hard may indicate infection or an adverse reaction. Contact your veterinarian if you notice anything unusual. 5. Managing mild reactions at home. Most mild reactions can be managed easily at home. Fever or lethargy. Encourage rest and provide a quiet, comfortable area. Loss of appetite. Offer small portions of favorite food, warm the food slightly, or provide wet food to stimulate eating. Injection site discomfort. Do not massage or apply topical remedies unless instructed by your veterinarian. Gentle observation is usually enough. Sneezing or mild nasal discharge. Ensure the kitten's environment is dust-free, warm, and comfortable. Avoid giving human medications unless prescribed by your veterinarian. Over-the-counter medications can be harmful to kittens. 6. When to contact the veterinarian. While most reactions are mild, it is important to know when to seek professional help. Contact your veterinarian immediately if you observe persistent vomiting or diarrhea, high fever lasting more than 24 hours, severe lethargy or weakness, swelling or lumps that worsen at the injection site, difficulty breathing, coughing, or gagging, signs of pain or distress that don't improve. Prompt action can prevent complications and ensure your kitten stays safe. 7. Keeping accurate post-vaccination records. Maintaining detailed records after each vaccine helps you track your kitten's health and schedule future boosters. Include date and type of vaccine, any reactions observed, measures taken to manage side effects, notes on appetite, activity, and behavior. Accurate records provide valuable information for your veterinarian and help ensure your kitten completes the vaccination schedule properly. 8. Supporting your kitten's immune system. Post-vaccination care is not only about monitoring, but also about supporting the immune system to respond effectively. Nutrition. Continue feeding high-quality kitten food with sufficient protein, vitamins, and minerals. Hydration. Keep fresh water accessible at all times. Rest. Ensure your kitten has ample quiet time to sleep and recover. Environmental enrichment. Provide gentle play, scratching posts, and safe toys to keep your kitten mentally stimulated without overstressing them. A strong immune system improves the effectiveness of vaccines and promotes overall health. 9. Planning for follow-up vaccinations. Vaccines are often given in series or boosters to ensure long-term protection. After a vaccination, plan the following. Note the next dose on your calendar or record system. Schedule follow-up appointments as recommended by your veterinarian. Adjust plans if your kitten experiences mild reactions, but never skip doses without consulting your veterinarian. Consistent follow-up ensures your kitten develops full immunity and remains protected from serious diseases. 10. Long-term health monitoring. Vaccinations are part of a broader preventive care routine. Long-term monitoring includes regular vet checkups, parasite prevention, fleas, ticks, worms, weight tracking and growth monitoring, observing behavior and activity levels for signs of illness. By integrating vaccinations with preventive care, you create a strong foundation for your kitten's health, ensuring they grow into a healthy and happy adult cat. Summary. Post-vaccination care is essential for your kitten's safety and well-being. Understanding normal reactions, observing your kitten closely, managing mild side effects, and knowing when to seek veterinary help all contribute to a smooth and effective vaccination experience. Proper post-vaccination care supports your kitten's immune system, builds trust, and ensures long-term protection against preventable diseases. In the next chapter, we will discuss common vaccination myths and misconceptions, helping you separate fact from fiction and make informed decisions about your kitten's health. Welcome to Chapter 6 of our Kitten Vaccination series. In this chapter, we'll discuss some of the most common myths and misconceptions about kitten vaccinations. Understanding the facts behind these myths will help you make informed decisions and feel confident in protecting your kitten's health. Misinformation can lead to skipped vaccines or delays, putting your kitten at risk of serious diseases. 1. Myth. Kittens don't need vaccines if they stay indoors. One of the most common misconceptions is that indoor kittens don't require vaccinations. While it's true that indoor kittens have lower exposure to infectious diseases, core vaccines are still essential. Diseases like feline panleukopenia, herpes virus, calicivirus, and rabies can be transmitted by visitors, other pets, or even contaminated items brought indoors. Rabies, in particular, is a legal requirement in many parts of the United States, regardless of whether your kitten stays indoors. Vaccinating indoor kittens ensures they remain protected and prevents accidental outbreaks within households. 2. Myth. Vaccines can overload a kitten's immune system. Some pet owners worry that multiple vaccines will overload a kitten's immune system. In reality, kittens are exposed to countless bacteria and viruses every day, and their immune system is well equipped to handle vaccines. Vaccines are specifically designed to stimulate the immune system safely and efficiently. Combination vaccines, like FVRCP, are carefully formulated to protect against multiple diseases in a single shot without overwhelming the kitten. The series of doses over several weeks ensures gradual and strong immunity without compromising health. 3. Myth. Vaccines cause the disease they are supposed to prevent. This is a common fear among new kitten owners. Vaccines do not cause the disease they are meant to prevent. Vaccines contain either inactive or weakened parts of a virus or bacteria, enough to trigger an immune response without causing illness. For example, the panleukopenia vaccine cannot give your kitten feline distemper. Mild symptoms like fever, lethargy, or slight swelling at the injection site are normal reactions to the immune system's response, not signs of the disease itself. 4. Myth. Kittens only need vaccines once. Some people believe a single round of vaccines is enough for lifetime protection. In reality, vaccines require a series of doses and boosters to ensure full immunity. Core vaccines like FVRCP are given in a series every 3 to 4 weeks until around 16 weeks of age. Rabies vaccines often require a booster 1 year after the initial shot, and then every 1 to 3 years depending on local regulations and vaccine type. Non-core vaccines, if recommended, also have their own schedules for boosters. Skipping doses or failing to provide boosters leaves your kitten partially protected and vulnerable to preventable diseases. 5. Myth: natural immunity is better than vaccination. Some owners believe that allowing kittens to contract mild infections naturally will strengthen their immunity. While kittens can develop immunity from natural infections, this approach is risky and potentially deadly. Diseases like panleukopenia or rabies can be fatal, and relying on natural exposure is far more dangerous than vaccination. Vaccines provide targeted, controlled protection without exposing your kitten to severe illness. 6. Myth: vaccines are unsafe for young kittens. Another misconception is that vaccines are unsafe for kittens under a certain age. In fact, veterinarians carefully schedule vaccines starting from 6 to 8 weeks of age based on research and best practices. Kittens are most vulnerable to infections during the early weeks, making timely vaccination critical. The vaccination schedule is designed to maximize immunity while minimizing risk, and vaccines used today are highly safe and thoroughly tested. 7. Myth: vaccines are only necessary for outdoor cats. Similar to the first myth, some owners think only outdoor cats need vaccines. Even indoor kittens can encounter diseases indirectly. Visitors may carry germs on clothing or hands. Contaminated items brought into the home can transmit viruses. Other pets may act as carriers. Core vaccines provide protection regardless of lifestyle, and non-core vaccines can be tailored to your kitten's specific exposure risks. 8. Myth: vaccines cause long-term health problems. There is concern that vaccines may cause chronic health issues. Research shows that vaccines are generally very safe, and the risk of severe long-term side effects is extremely low. Mild, temporary reactions such as slight fever, lethargy, or soreness at the injection site are normal. Serious reactions are rare, and veterinarians are trained to identify and manage them promptly. The benefits of vaccination far outweigh the minimal risks. 9. Myth: more vaccines are better. While it may seem that giving more vaccines provides extra protection, over-vaccination is unnecessary. Vaccination schedules are carefully designed to provide optimal immunity at the right time. Giving extra vaccines outside the recommended schedule does not improve immunity and may increase the risk of side effects. Veterinarians tailor vaccine schedules based on your kitten's age, lifestyle, and health, providing protection without unnecessary doses. 10. Myth: vaccines are expensive and not worth it. Some people avoid vaccines because of perceived cost. While there is an upfront expense, vaccines are a small investment compared to the cost of treating preventable diseases. For example, treating panleukopenia, respiratory infections, or rabies exposure can be far more expensive than vaccines. Hospitalization, medications, and supportive care for infected kittens add stress and financial burden. Vaccination protects your kitten's health, reduces veterinary costs in the long run, and ensures a longer, healthier life. Separating fact from fiction. Understanding vaccination myths helps you make informed decisions for your kitten's health. Here are some key takeaways. Vaccines are safe and essential, even for indoor kittens. Mild side effects are normal. Serious reactions are rare. Core vaccines protect against life-threatening diseases. Non-core vaccines are tailored to specific risk factors. Following the recommended schedule ensures complete and long-lasting immunity. How to stay informed. To combat myths and misinformation, rely on credible sources, such as veterinarians, veterinary associations, and peer-reviewed studies. Ask your veterinarian questions about any concerns or vaccine options. Keep detailed records of all vaccinations, side effects, and booster schedules. Educate family members or caregivers about the importance of following the vaccination plan. Being informed allows you to confidently protect your kitten, avoid preventable diseases, and make decisions based on science, not hearsay. Summary: vaccination myths and misconceptions can create unnecessary anxiety and risk for kittens. Understanding the facts, following a veterinarian-approved schedule, and keeping accurate records ensure your kitten receives the best protection possible. Vaccines are one of the most effective ways to keep your kitten healthy, happy, and safe from life-threatening diseases. In the next chapter, we will discuss how to maintain long-term immunity in cats, including booster schedules, adult cat vaccinations, and lifestyle considerations that help your cat stay protected throughout life. Welcome to Chapter 7 of our Kitten Vaccination series. In this chapter, we'll discuss how to maintain long-term immunity in cats. Vaccinations are critical during the kitten stage, but immunity isn't a one-time event. Proper follow-up care, booster vaccinations, and lifestyle considerations are essential for keeping your cat protected throughout life. By understanding long-term immunity, you can ensure your cat remains healthy, safe, and free from preventable diseases. 1. Understanding how immunity works. Vaccines stimulate your cat's immune system to recognize and fight infections. After initial vaccination, your kitten develops active immunity, which protects them against specific diseases. Over time, however, immunity can wane, which is why booster vaccinations are necessary. There are two types of immunity to consider. Active immunity, developed from vaccination or exposure to a disease. This is long-lasting but may require boosters to maintain strength. Passive immunity, temporary protection passed from mother to kitten through colostrum during the first few weeks of life. Passive immunity gradually decreases as the kitten's immune system matures. Understanding this balance is important because it helps explain why kittens receive multiple doses of vaccines in early life and why adult cats need boosters. 2. Core vaccine boosters. Core vaccines, which include FVRCP, feline viral rhinotracheitis, calicivirus, panleukopenia, and rabies, require booster doses throughout life. FVRCP. After completing the initial kitten series, a booster is recommended at 1 year of age, followed by boosters every 3 years, depending on your veterinarian's advice and the vaccine type. Rabies, required by law in most U.S. states. The first booster is given 1 year after the initial shot, with subsequent boosters every 1 to 3 years. These boosters ensure your cat's immune system maintains strong protection against life-threatening diseases, even as they age. 3. Non-core vaccine boosters. Non-core vaccines, given based on lifestyle or risk factors, also require boosters. Feline leukemia virus, FALV kittens at risk receive the initial series and a booster at 1 year, with further boosters annually if risk continues. Feline immunodeficiency virus, FIV, follow your veterinarian's schedule for booster doses. Chlamydia and Bordetella usually require boosters as determined by exposure risk. Even adult cats that were not previously vaccinated may benefit from non-core vaccines if their environment or lifestyle changes, such as boarding, travel, or exposure to other cats. 4. Annual health checkups. Annual veterinary visits are vital for maintaining long-term immunity. During these visits, your veterinarian will assess overall health and growth, update vaccination status, and administer boosters. Test for diseases like FALV or FIV if necessary. Discuss lifestyle changes, such as outdoor access or multi-cat environments. Address any emerging health concerns. Regular checkups ensure your cat receives vaccines on schedule and maintains optimal immunity throughout life. 5. Monitoring your cat's health. Maintaining immunity isn't just about vaccines. Monitoring your cat's overall health is equally important. Nutrition. A balanced diet supports immune function and overall vitality. High-quality protein, vitamins, and minerals help maintain strong defenses against disease. Parasite control. Flea, tick, and worm prevention reduces stress on the immune system and prevents secondary infections. Environment. Limiting exposure to sick cats, crowded spaces, or unsanitary conditions reduces the risk of infection. A healthy lifestyle complements vaccination, helping your cat respond effectively to boosters and fight off infections naturally. 6. Adjusting vaccination plans for adult cats. As cats age, their risk profiles may change. Your veterinarian may adjust the vaccination schedule based on indoor versus outdoor lifestyle. Outdoor cats face higher exposure to contagious diseases and may require more frequent boosters. Travel or boarding. Cats entering boarding facilities or traveling may need additional protection against respiratory diseases. Health conditions. Chronic illnesses, immune disorders, or prior vaccine reactions may require modified schedules. Tailoring vaccination plans ensures that adult cats remain protected while minimizing unnecessary vaccinations. 7. Maintaining immunity in multi-cat households. Multi-cat households pose unique challenges because infectious diseases can spread quickly among cats. To maintain immunity, ensure all cats are up to date with core vaccines. Consider non-core vaccines if there is risk of FALV, FIV, or respiratory infections. Practice good hygiene, such as cleaning litter boxes, food bowls, and bedding regularly. Isolate sick cats promptly to prevent transmission. By combining vaccination with good management practices, you create a safe and healthy environment for all cats in the household. 8. Seasonal and environmental considerations. Seasonal changes or environmental factors may also influence immunity. Cold or rainy weather may increase exposure to respiratory illnesses indoors if cats are confined to small spaces. Travel seasons like holidays may increase contact with other cats at boarding facilities. Outdoor exposure in areas with high stray cat populations increases disease risk. Being mindful of these factors helps you plan booster schedules and preventive care effectively. 9. Signs that your cat may need additional protection. Even vaccinated cats may occasionally require extra protection. Watch for exposure to sick or unvaccinated cats, outdoor roaming in high-risk areas, boarding, shows, or social gatherings with many cats, health changes that affect the immune system. Consult your veterinarian if any of these situations arise. They may recommend additional vaccines, boosters, or preventive measures to maintain strong immunity. 10. Keeping accurate lifetime vaccination records. Long-term immunity requires careful record keeping. Maintain detailed records including vaccines administered and dates, booster schedules and next due dates, any adverse reactions or side effects, lifestyle changes that may affect risk. Accurate records help your veterinarian provide the best advice and ensure your cat remains protected throughout their life. Digital records, apps, or printed vaccination cards are all effective tools. Summary: maintaining long-term immunity is a combination of timely vaccinations, boosters, health monitoring, and preventive care. Adult cats require continued attention to ensure the protection they received as kittens is sustained throughout life. By following a veterinarian-approved schedule, monitoring health, and adjusting care as needed, you give your cat the best chance for a healthy, disease-free life. In the next and final chapter, we will provide a comprehensive vaccination timeline and checklist for kittens, summarizing core and non-core vaccines, boosters, and key reminders to make it easy for cat owners to stay organized and ensure full protection. Welcome to Chapter 8, the final chapter of our Kitten Vaccination series. In this chapter, we will provide a comprehensive vaccination timeline and checklist for kittens. This chapter is designed to give you a clear, step-by-step guide to ensure your kitten receives all the necessary vaccinations at the right time, along with boosters and special considerations. Following this guide helps keep your kitten protected from preventable diseases and makes it easier to stay organized throughout your cat's life. 1. Why a vaccination timeline is important. A vaccination timeline ensures that your kitten develops strong immunity against core diseases, receives non-core vaccines if necessary, based on lifestyle and risk factors, completes booster schedules for long-term protection, avoids missed or late vaccinations, which can leave them vulnerable. Kittens' immune systems are still developing, and timing is critical. Vaccines given too early may be blocked by maternal antibodies, while delayed vaccines can leave gaps in protection. A clear timeline helps avoid these issues. 2. Core vaccines, recommended schedule. Core vaccines protect against life-threatening diseases and are recommended for all kittens. FVRCP, feline viral rhinotracheitis, calicivirus, panleukopenia. First dose, 6 to 8 weeks of age. Second dose, 10 to 12 weeks. Third dose, 14 to 16 weeks. Booster, 1 year after the last kitten dose. Subsequent boosters, every 3 years or as advised by your veterinarian. FVRCP protects against 3 major diseases. Rhinotracheitis, caused by feline herpes virus, leads to respiratory issues and eye infections. Calicivirus, causes respiratory illness, oral ulcers, and occasionally severe systemic disease. Panleukopenia, feline distemper, a highly contagious and potentially fatal disease affecting the gastrointestinal tract and immune system. Rabies vaccine. First dose, typically 12 to 16 weeks of age, depending on state law. Booster, 1 year after initial vaccination. Subsequent boosters, every 1 to 3 years depending on vaccine type and local regulations. Rabies is a fatal viral disease that affects the nervous system. It is legally required in most areas and protects both your kitten and your household. 3. Non-core vaccines, recommended schedule. Non-core vaccines are given based on risk factors and environment. Your veterinarian will advise which ones are necessary. Feline leukemia virus, FALV. First dose, 8 weeks. Second dose, 12 weeks. Booster, 1 year after initial series. Annual boosters, recommended for at-risk kittens. Feline immunodeficiency virus, FIV. Schedule determined by veterinarian. Typically given in a series, followed by boosters based on risk. Chlamydia felis. First dose, 9 to 10 weeks. Second dose, 12 to 13 weeks. Boosters as recommended for high-risk environments, like multi-cat households or shelters. Bordetella. Given based on exposure risk, boarding, shows, or multi-cat homes. Administered intranasally or by injection. Booster schedule depends on veterinarian recommendation. 5. Tips for using the timeline effectively. Keep a physical record. Use a notebook, folder, or printed vaccination card. Digital reminders. Set calendar alerts for upcoming boosters or vet visits. Include non-core vaccines. Note optional vaccines like FALV, FIV, chlamydia, or bordetella. Track side effects. Record any reactions to vaccines, even mild ones. Update lifestyle changes. Note if your kitten starts going outdoors, attending shows, or boarding, which may require additional protection. 6. Checklist for each vaccination visit. To ensure a smooth vaccination process, use this checklist. Welcome to Chapter 9 of our Kitten Vaccination series. In this chapter, we will explore advanced tips to ensure your vaccinated kitten stays healthy long-term. Vaccination is just one step in keeping your kitten safe. Combining vaccines with proper care, monitoring, nutrition, and lifestyle management helps your kitten thrive and prevents disease throughout life. 1. Understanding lifelong immunity. Even after completing the Kitten Vaccination series, immunity is not permanent without maintenance. Kittens develop protection from vaccines, but over time, antibody levels may decline. Environmental exposure may increase. Lifestyle changes can introduce new risks. Understanding this helps you appreciate why booster schedules and regular veterinary visits are essential. 2. Nutrition for immune support. Good nutrition is the cornerstone of a healthy immune system. High-quality protein supports growth and immune function. Vitamins and minerals. Vitamins A, E, C, and minerals like zinc help immunity. Hydration. Fresh water is essential for metabolic health and toxin elimination. Age-appropriate food. Kittens need nutrient-rich diets for growth, while adult cat diets focus on maintenance. Feeding your cat balanced meals enhances vaccine effectiveness and overall health. 3. Parasite prevention. Parasites can weaken immunity and interfere with vaccination effectiveness. Maintain a regular parasite prevention routine. Flea and tick control. Deworming schedules. Heartworm prevention if recommended by your veterinarian. Parasite-free kittens are healthier and respond better to vaccines. 4. Stress reduction and mental health. Stress affects immunity. Even vaccinated kittens can become susceptible to illness if stressed. Tips for stress reduction include safe spaces. Provide quiet areas with bedding and hiding spots. Routine. Keep feeding, play, and grooming schedules consistent. Gentle handling. Avoid rough play that can induce anxiety. Environmental enrichment. Toys, scratching posts, and interactive play reduce stress. A calm and enriched environment supports strong immune responses. 5. Monitoring health post-vaccination. Even after completing the vaccine series, continuous monitoring is important. Track appetite, activity, and weight. Observe for unusual symptoms like sneezing, vomiting, or diarrhea. Note any adverse reactions to boosters. Consult a veterinarian promptly if health changes occur. Early detection of issues prevents minor problems from becoming serious. 6. Lifestyle considerations. Your kitten's environment affects vaccination effectiveness and overall health. Indoor versus outdoor. Outdoor cats are exposed to more pathogens and may need additional vaccines. Boarding or shows. Temporary exposure requires updated vaccines and preventive care. Multi-cat households. Higher risk of disease transmission, reinforcing the need for complete vaccination coverage. Adapting care based on lifestyle ensures vaccines remain effective in real-world conditions. 7. Safe socialization. Proper socialization supports mental health and immunity. Introduce kittens to other vaccinated cats gradually. Avoid sick animals during socialization. Reward positive interactions to reduce stress and fear. Healthy social experiences reduce stress and boost overall well-being. 8. Record keeping and documentation. Maintaining meticulous records ensures lifelong protection. Record all vaccine types, dates, and booster schedules. Note any side effects or reactions. Keep track of lifestyle changes affecting disease risk. Digital apps or printed logs help manage long-term vaccination plans. Well-organized records make veterinary visits smoother and reduce errors. 9. Recognizing early signs of disease. Even vaccinated kittens may occasionally face illness. Recognize early signs to prevent complications. Sneezing, coughing, or nasal discharge. Diarrhea or vomiting. Loss of appetite or weight. Lethargy or unusual behavior. Prompt veterinary care allows early intervention and maintains long-term health. 10. Planning for adult and senior cats. Vaccination is an ongoing commitment. Adult boosters. Maintain immunity with scheduled boosters every 1 to 3 years. Senior care. Older cats may have weaker immune responses and need regular health monitoring. Adjust lifestyle care. Diet, exercise, and preventive medicine should adapt to age-related changes. A proactive approach ensures your cat's health is protected for life. Summary. Vaccination is the foundation of your kitten's health, but advanced care practices are essential to ensure long-term protection. Nutrition, parasite control, stress reduction, monitoring, and proper record-keeping all work together to keep your kitten healthy. By combining vaccines with holistic care, you ensure your kitten thrives into adulthood and enjoys a disease-free, happy life. Welcome to Chapter 10 of our Kitten Vaccination series. In this chapter, we'll cover how to prepare for emergency situations and special cases related to vaccinations. While vaccines protect your kitten from many diseases, it's essential to be prepared for unexpected health issues, adverse reactions, travel, boarding, and other special circumstances. Being proactive ensures your kitten stays safe and well cared for, even in challenging situations. 1. Understanding emergency situations. Despite vaccinations, kittens can encounter unexpected health events. Emergency situations may include severe allergic reactions to vaccines, sudden illness unrelated to vaccines, accidents or injuries, exposure to infectious diseases despite vaccination. Being prepared allows you to respond quickly and reduce the risk of serious complications. 2. Recognizing severe vaccine reactions. Most vaccine reactions are mild, but severe reactions can occur rarely. Signs of serious reactions include swelling of the face, lips, or throat, difficulty breathing or wheezing, vomiting or diarrhea immediately after vaccination, collapse or extreme lethargy, persistent high fever. If you observe any of these symptoms, seek veterinary care immediately. Early intervention is often life-saving. 3. Emergency preparedness at home. To handle emergencies effectively, maintain the following. Emergency contacts. Keep your veterinarian's number, after-hours clinic, and poison control information handy. First aid supplies include bandages, antiseptic wipes, and a thermometer suitable for kittens. Transport plan. Know how to safely transport your kitten to a clinic if needed. Medical records. Have vaccination and health history accessible at all times. Being organized ensures rapid response and minimizes stress for both you and your kitten. 4. Travel and boarding considerations. Travel or boarding situations can pose additional health risks. Vaccination proof. Most boarding facilities require up-to-date vaccinations for core and sometimes non-core vaccines. Travel stress. Stress can temporarily weaken the immune system, making preventive care crucial. Carriers and safety. Use secure, comfortable carriers with familiar bedding to reduce anxiety. Hydration and nutrition. Ensure access to water and regular meals during travel or boarding. Planning ahead ensures that vaccination protection is maintained and your kitten remains safe and healthy. 5. Managing chronic illness or special health conditions. Kittens with chronic conditions or special health considerations require tailored vaccination strategies. Immune-compromised kittens may need modified vaccine schedules. Kittens with allergies. Monitor closely for reactions. Pre-medication may be recommended in rare cases. Pre-existing conditions, heart, kidney, or liver issues may require adjustments in care and monitoring. Work closely with your veterinarian to develop a customized plan for kittens with special needs. 6. Record keeping for emergencies. Accurate, up-to-date records are essential in emergencies. Keep a copy of vaccination records with your kitten. Note any prior reactions, allergies, or chronic conditions. Include emergency contacts and preferred veterinary clinics. Maintain digital backups for easy access while traveling or boarding. Well-organized records facilitate quick decision-making in urgent situations. 7. Observation after vaccination. Even after returning home from the clinic, observe your kitten closely for 24 to 48 hours. Monitor appetite, behavior, and activity levels. Check the injection site for swelling or redness. Look for any signs of unusual illness. Keep your kitten in a quiet, stress-free environment during recovery. Early detection of adverse reactions or illness allows for prompt veterinary intervention. 8. Special situations requiring attention. Certain circumstances may require additional precautions. Multiple cat households. Isolate any sick cats and ensure all pets are up to date on vaccines. Outdoor kittens. Increased risk of exposure may necessitate additional vaccines or boosters. Boarding or shows. Stress and exposure to other animals increase susceptibility to infection. Travel to new regions. Some areas may have local disease risks. Consult your veterinarian. Planning for these situations helps maintain vaccine protection and kitten health. 9. Emergency kit essentials. A basic emergency kit for your vaccinated kitten should include copy of vaccination and health records, carrier for safe transport, thermometer for monitoring temperature, soft blankets or bedding, water and food for short-term care, contact information for your veterinarian and emergency clinics. Having these items prepared reduces response time and keeps your kitten safe during unexpected events. 10. Preventive mindset for lifelong health. While emergencies can happen, a preventive mindset is your best strategy. Stay on schedule with boosters. Maintain parasite control and preventive care. Monitor health regularly and consult your veterinarian as needed. Adjust lifestyle and environment based on risk factors. By being proactive, you minimize emergencies and ensure your kitten remains protected, healthy, and happy throughout life. Summary. Vaccination is a critical foundation for your kitten's health, but preparation for emergencies and special situations completes the picture. Recognizing severe reactions, maintaining accurate records, planning for travel or boarding, and monitoring health daily all contribute to your kitten's safety. A proactive, organized approach ensures that your vaccinated kitten thrives under all circumstances. Welcome to Chapter 11 of our Kitten Vaccination series. In this chapter, we'll discuss how travel, outdoor exposure, and specific lifestyle factors affect vaccinated kittens. Vaccination provides a strong foundation of protection, but your kitten's environment, routine, and lifestyle choices play a major role in maintaining immunity and overall health. By understanding the risks and planning ahead, you can keep your kitten safe, happy, and protected in any situation. 1. Vaccinated kittens and outdoor exposure. Even vaccinated kittens can face increased risk when spending time outdoors. Disease exposure. Outdoor cats may encounter viruses or bacteria not commonly found indoors, including feline leukemia virus, FALV, or feline immunodeficiency virus, FIV. Parasites, fleas, ticks, mosquitoes, and worms are more prevalent outdoors. Injuries, fights with other animals, car accidents, or falls. Environmental toxins, pesticides, antifreeze, and other chemicals can be dangerous. Vaccines protect against core diseases, but they cannot prevent injuries or all infections. Outdoor exposure requires vigilance and preventive care. 2. Preparing for outdoor adventures. If you plan to allow your kitten outdoor time, follow these steps. Vaccination check. Ensure all core and relevant non-core vaccines are up to date. Parasite prevention. Use flea, tick, and worm preventives recommended by your veterinarian. Safe boundaries. Consider enclosed patios, harnesses, or cat-proof fencing. Supervised play. Limit unsupervised roaming to reduce risks. Gradual and controlled exposure helps your kitten safely explore the outdoors while maintaining vaccine protection. 3. Travel precautions for vaccinated kittens. Traveling with your kitten, whether by car, plane, or other means, requires planning. Carrier safety. Use a secure, comfortable carrier with familiar bedding. Travel vaccination proof. Many boarding facilities and airlines require up-to-date vaccines. Health check before travel. Ensure your kitten is healthy and fit for the journey. Hydration and feeding. Provide water and small meals during travel breaks. Minimizing stress during travel also reduces the risk of illness, as stress can temporarily weaken the immune system. 4. Boarding and cat care facilities. Boarding or cat care facilities can expose kittens to other animals and pathogens. Vaccination requirements. Confirm the facility requires current core and non-core vaccines. Facility hygiene. Ensure the environment is clean and well-maintained. Behavior observation. Discuss your kitten's temperament and stress response with staff. Emergency plan. Provide contact info and health records for veterinary care if needed. Proper preparation ensures your vaccinated kitten stays protected in communal settings. 5. Multi-cat household considerations. Living with multiple cats requires extra precautions to maintain immunity. Vaccination compliance. Ensure all cats are up to date on core vaccines. Non-core vaccines. Consider additional vaccines like FALV if new cats are introduced. Hygiene practices. Clean litter boxes, food bowls, and bedding regularly. Monitoring health. Watch for signs of illness in all cats and isolate sick animals promptly. A consistent preventive approach reduces disease transmission and protects all members of the household. 6. Lifestyle factors affecting vaccine effectiveness. Certain lifestyle factors influence how well vaccines protect your kitten. Diet and nutrition. A balanced diet supports a strong immune system. Stress management. Chronic stress reduces immunity, making kittens more susceptible. Activity levels. Regular exercise maintains overall health. Environmental exposure. Contaminated areas or unsanitary conditions increase risk of infection. By maintaining a healthy lifestyle, you enhance vaccine effectiveness and overall resilience. 7. Travel and environmental risks abroad. For families traveling internationally or to areas with different disease prevalence, consult a veterinarian. Discuss required vaccinations for the destination. Update boosters. Ensure core and non-core vaccines are current. Quarantine rules. Check local regulations for entry requirements. Parasite control. Consider additional preventive measures for region-specific parasites. Preparation ensures your kitten remains healthy and compliant with legal and veterinary guidelines. 8. Monitoring kittens after outdoor or travel exposure. After outdoor adventures or travel, carefully observe your kitten for signs of illness. Respiratory symptoms, sneezing, coughing, or nasal discharge. Gastrointestinal issues, vomiting or diarrhea. Behavioral changes, lethargy, hiding, or reduced appetite. Injection site reactions, swelling or redness. Prompt veterinary attention can prevent minor issues from escalating. 9. Special considerations for senior or health-challenged cats. Even vaccinated kittens growing into adult or senior cats may need tailored strategies. Adjust outdoor exposure based on mobility and immune health. Maintain up-to-date vaccines and boosters. Increase monitoring during travel or boarding situations. Provide stress reduction and comfortable resting areas. A proactive approach ensures long-term protection and quality of life for cats of all ages. 10. Planning a comprehensive lifestyle and vaccination strategy. Combining vaccination with lifestyle management ensures optimal health. Maintain an updated vaccination schedule with boosters. Protect against parasites and environmental risks. Provide a balanced diet and regular exercise. Supervise outdoor activities and travel. Monitor for illness and respond promptly. Creating a structured plan for your kitten's environment, activity, and preventive care enhances immunity and promotes lifelong health. Summary. Vaccination provides the foundation for your kitten's health, but lifestyle, outdoor exposure, travel, and environmental factors play a crucial role in maintaining protection. By following preventive strategies, observing your kitten closely, and working with your veterinarian, you ensure that your kitten remains safe, healthy, and fully protected throughout life, even in special or high-risk situations. Welcome to Chapter 12 of our Kitten Vaccination series. In this chapter, we'll discuss holistic health practices and long-term wellness strategies for vaccinated kittens. While vaccinations are critical for protecting against infectious diseases, they are just one part of ensuring lifelong health. Combining vaccination with proper nutrition, exercise, preventive care, mental enrichment, and stress reduction creates a foundation for a happy, healthy, and thriving cat. 1. Understanding holistic health. Holistic health focuses on the whole well-being of your kitten, including physical, mental, and emotional aspects. Vaccinations protect against specific diseases, but overall wellness requires attention to nutrition and hydration, exercise and physical fitness, mental stimulation and socialization, parasite prevention, regular veterinary care. By addressing all aspects of health, you enhance vaccine effectiveness and reduce the likelihood of illness. 2. Nutrition for optimal immunity. Proper nutrition strengthens the immune system and supports growth. High-quality protein, essential for muscle development and antibody production. Vitamins and minerals, vitamin A, C, E, and zinc help immune responses. Hydration. Fresh water is vital for metabolism and toxin elimination. Balanced diet. Age-appropriate food supports development from kittenhood into adulthood. Avoid overfeeding or feeding low-quality diets, as malnutrition or obesity can compromise immunity and overall health. 3. Exercise and physical activity. Regular exercise maintains healthy weight and enhances immune function. Interactive play, toys, laser pointers, and wand toys stimulate movement. Exploration. Safe outdoor access or indoor climbing structures. Scheduled activity. Consistent playtime routines reduce stress and promote physical health. Active kittens develop stronger muscles, improved cardiovascular health, and reduced stress, all of which contribute to better immune responses. 4. Mental stimulation and enrichment. Mental health is as important as physical health. Puzzle feeders and treat dispensing toys encourage problem solving. Scratching posts and climbing trees provide natural behaviors and environmental enrichment. Social interaction, gentle handling and play with humans or other cats. Variety, rotate toys and activities to prevent boredom. A stimulated mind supports overall wellness and reduces stress-induced immune suppression. 5. Parasite prevention. Parasites can compromise health and vaccine effectiveness. Flea and tick control, monthly or as recommended by your veterinarian. Deworming, regular schedules prevent gastrointestinal parasites. Environmental hygiene, keep litter boxes clean and avoid unsanitary conditions. Preventing parasitic infections protects long-term immunity and overall well-being. 6. Stress management and comfort. Stress affects immunity, behavior, and overall health. Safe spaces, provide quiet areas and hiding spots. Consistent routine, feeding, play, and grooming schedules. Positive reinforcement, gentle handling and rewards reduce anxiety. Calm environment, avoid loud noises, sudden changes, or aggressive pets. A stress-free kitten responds better to vaccines and maintains long-term health. 7. Regular veterinary care. Even vaccinated kittens need ongoing veterinary attention. Annual wellness exams. Booster vaccinations as scheduled. Routine blood work and screenings as recommended. Dental checks and hygiene. Early detection of chronic or emerging health issues. Consistent veterinary care ensures your kitten remains protected and healthy throughout life. 8. Monitoring for early signs of illness. Proactive monitoring allows early intervention. Appetite changes, vomiting or diarrhea, sneezing, coughing, or nasal discharge, lethargy or unusual hiding, weight loss or gain. Prompt veterinary attention reduces complications and enhances long-term wellness. 9. Safe socialization. Socialization supports emotional and behavioral health. Gradual introduction to other vaccinated cats or pets. Positive experiences with humans and new environments. Supervised interactions to prevent stress or injury. Healthy social experiences reduce fear, anxiety, and behavioral issues, supporting overall well-being. 10. Integrating vaccination with holistic care. Vaccinations are most effective when combined with holistic practices. Balanced nutrition and hydration. Regular exercise and mental stimulation. Parasite prevention and hygiene. Stress management and safe environment. Ongoing veterinary care and monitoring. This integrated approach ensures vaccines work optimally while promoting long-term wellness. Summary. Holistic health practices enhance the effectiveness of vaccinations and ensure your kitten thrives in all aspects of life. Proper nutrition, physical activity, mental enrichment, stress reduction, parasite control, and regular veterinary care create a foundation for lifelong immunity and overall health. By combining vaccination with these holistic strategies, you give your kitten the best chance for a happy, healthy, and disease-free life. Welcome to Chapter 13 of our Kitten Vaccination series. In this chapter, we will explore special considerations for kittens living in multi-cat households or interacting with community cats. Vaccination provides essential protection, but environments with multiple cats or exposure to strays require extra vigilance to prevent disease, maintain long-term immunity, and ensure the overall well-being of your kitten. 1. Risks in multi-cat households. Multi-cat households come with unique health challenges. Increased disease exposure, respiratory infections, FALV, and FIV can spread more easily. Parasite transmission, fleas, ticks, and worms spread quickly between cats. Stress and competition, multiple cats can induce anxiety, affecting immunity and behavior. Injury risk, fighting or territorial disputes can result in scratches, bites, or wounds. Even vaccinated kittens can be vulnerable if the environment is not carefully managed. 2. Vaccination strategies in multi-cat homes. To protect kittens in households with multiple cats. Ensure all cats are up to date on core vaccines. Consider non-core vaccines such as FALV if new cats are introduced. Vaccinate new kittens before introduction to protect against common pathogens. Maintain booster schedules for adult cats to sustain herd immunity. Vaccination compliance across all cats reduces disease transmission and protects vulnerable kittens. 3. Environmental hygiene practices. Maintaining cleanliness is crucial for preventing illness. Separate litter boxes, 1 per cat, plus 1 extra, cleaned daily. Food and water bowls. Keep bowls clean and separate to prevent sharing of pathogens. Bedding and toys. Wash regularly and rotate to reduce contamination. Surface cleaning. Sanitize common areas with pet-safe disinfectants. A clean environment supports immunity and reduces infection risk, even for vaccinated kittens. 4. Stress management in multi-cat homes. Stress can weaken immunity and increase susceptibility to illness. Provide personal space. Each cat should have access to quiet areas. Vertical territory. Cat trees or shelves allow escape from dominant cats. Consistent routine. Feeding and play schedules help reduce stress. Gradual introductions. Slow introductions between new and resident cats prevent conflict. Stress reduction complements vaccination, helping kittens remain healthy and immune. 5. Community cat exposure. Kittens may encounter community cats outdoors, which introduces additional risks. Infectious diseases. Unvaccinated or feral cats may carry FALV, FIV, or respiratory viruses. Parasites, fleas, ticks, and intestinal worms are more prevalent in stray populations. Injury risk. Fights with territorial strays can cause wounds or infections. Environmental hazards. Vehicles, toxins, or unsafe areas pose dangers. Even vaccinated kittens should avoid unsupervised contact with community cats to reduce risk. 6. Controlled socialization with other cats. When interacting with other cats, vaccinate first. Ensure your kitten is fully vaccinated before social exposure. Supervised meetings. Introduce cats gradually in neutral spaces. Observe behavior. Watch for signs of aggression or stress. Maintain hygiene. Clean hands, toys, and feeding areas to prevent disease spread. Careful socialization supports mental health while minimizing infection risk. 7. Monitoring health in multi-cat environments. Kittens in households or environments with multiple cats require careful monitoring. Daily observation, appetite, behavior, grooming, and energy levels. Check for respiratory symptoms, sneezing, coughing, nasal discharge. Inspect skin and fur. Look for fleas, ticks, or irritation. Prompt veterinary care. Address unusual symptoms quickly to prevent outbreaks. Early detection is key to protecting vaccinated kittens in high-risk environments. 8. Preventive measures for long-term immunity. Even with multiple cats, you can maintain long-term immunity with these strategies. Booster vaccinations on schedule for all cats. Regular parasite control across the household. Environmental enrichment to reduce stress and promote healthy behaviors. Proper nutrition to support immune function. Preventive care ensures vaccines work effectively and reduces disease transmission risk. 9. Emergency planning in multi-cat households. Prepare for potential emergencies. Separate sick cats immediately to prevent spread. Keep emergency contacts handy, including veterinarian and poison control. Maintain up-to-date records for all cats, including vaccination status. First aid supplies, bandages, antiseptics, and carriers for transport. A proactive plan protects kittens and all cats in the household during unexpected health events. 10. Integrating holistic care and vaccination. Successful management of multi-cat households and community exposure involves combining holistic care with vaccination, nutrition and hydration, physical activity and play, mental stimulation and environmental enrichment, hygiene, parasite prevention, and stress reduction, regular veterinary checkups and booster vaccinations. This integrated approach supports long-term immunity, overall health, and safe social interactions for your kittens. Summary. Multi-cat households and interactions with community cats present unique challenges for vaccinated kittens. By implementing strict vaccination schedules, maintaining hygiene, reducing stress, controlling parasites, and monitoring health, you can ensure your kittens remain protected and thrive in these environments. Holistic care combined with proactive vaccination management provides a safe, healthy, and fulfilling life for kittens in complex household or community settings. Welcome to Chapter 14 of our Kitten Vaccination series. In this chapter, we'll explore how seasonal changes and regional differences can affect vaccinated kittens. While vaccines provide strong protection, disease prevalence, parasite activity, and environmental conditions vary by location and time of year. Understanding these factors helps ensure your kitten remains healthy and fully protected throughout the year, regardless of climate or geography. 1. Seasonal risks for vaccinated kittens. Even vaccinated kittens can face increased disease risks during certain seasons. Spring, rising temperatures and humidity encourage flea and tick activity. Summer, outdoor exploration increases exposure to parasites and infectious agents. Fall, cooler weather may concentrate indoor cats, increasing respiratory virus transmission. Winter, cold stress can weaken immunity and make kittens more susceptible to illness. Awareness of seasonal risks allows you to take preventive measures beyond vaccination. 2. Parasite prevention throughout the year. Parasite prevalence varies by season. Fleas and ticks, most active in warm months, year-round prevention may be necessary in mild climates. Heartworm, mosquito activity peaks in summer, preventive medication is crucial. Intestinal worms, increased hunting activity in spring and summer may expose kittens to parasites. Maintaining consistent parasite control is essential, even for fully vaccinated kittens. 3. Regional disease considerations. Disease prevalence varies across different geographic regions. Feline leukemia virus, FALV, higher prevalence in urban areas and regions with many outdoor or stray cats. Rabies, vaccination is legally required in most areas. Some regions have higher risk due to wildlife exposure. Feline infectious peritonitis, FIP, and respiratory viruses, more common in densely populated shelters or multi-cat environments. Consulting a local veterinarian helps determine region-specific vaccine recommendations and preventive measures. 4. Travel between regions. Traveling to a different region requires planning. Check vaccine requirements. Some states or countries require proof of rabies vaccination. Parasite prevention. Different regions may have unique flea, tick, or heartworm risks. Health check. Ensure your kitten is healthy and up-to-date on all vaccines before travel. Stress management. Prepare carriers and travel routines to reduce anxiety. Proper planning ensures your vaccinated kitten remains safe during seasonal or regional travel. 5. Climate-related considerations. Kittens' health can be affected by climate. Hot climates provide shade, hydration, and cool indoor spaces to prevent heat stress. Cold climates ensure warm bedding, indoor safety, and protection from frostbite or hypothermia. Humidity. High humidity can increase fungal infections and parasite survival. Rainy seasons reduce outdoor exposure to prevent infections and stress. Adapting care to your local climate complements vaccination protection. 6. Monitoring health in seasonal transitions. During seasonal changes, watch for subtle signs of illness. Respiratory symptoms, sneezing, coughing, or nasal discharge may indicate viral outbreaks. Appetite changes. Seasonal shifts may affect eating habits, requiring monitoring. Behavioral changes. Lethargy or hiding may reflect environmental stress or illness. Parasite signs. Increased scratching or hair loss can indicate fleas or ticks. Early detection allows for prompt veterinary intervention and continued protection. 7. Adjusting lifestyle based on seasons. Kittens' routines should adapt to seasonal conditions. Outdoor access. Limit outdoor time during extreme heat, cold, or high-risk parasite seasons. Playtime. Indoor enrichment may be necessary during inclement weather. Nutrition. Seasonal changes may require adjustments in diet or hydration practices. Vaccination timing. Ensure boosters are completed before high-risk seasons. Seasonal adjustments maintain health and enhance vaccine effectiveness. 8. Long-term planning for regional risks. Long-term health planning should account for regional disease risks. Urban versus rural exposure. Rural kittens may face wildlife-borne diseases. Urban kittens may encounter densely populated shelters. Travel history. Keep track of areas your kitten has visited to inform risk-based vaccination or parasite control. Consult local guidelines. Veterinarians provide tailored recommendations based on local epidemiology. Proactive regional planning ensures vaccinated kittens remain protected throughout life. 9. Emergency preparedness for seasonal outbreaks. Being prepared for seasonal disease outbreaks is critical. Keep vaccination records up to date. Ensure boosters are administered on schedule. Maintain emergency contacts, local veterinarian, after-hours clinics, and poison control. Isolation plan. Have a strategy to separate sick cats during seasonal outbreaks. Supplies. Stock preventive medications, hydration supplies, and clean bedding. Preparation reduces risk and ensures rapid response in high-risk periods. 10. Integrating seasonal and regional awareness with holistic care. Combining seasonal and regional considerations with holistic care enhances long-term health. Maintain vaccination schedules tailored to local risks. Provide parasite prevention year-round. Adjust routines, diet, and play based on climate and season. Observe health closely during seasonal transitions. Consult veterinarians for region-specific guidance. This integrated approach ensures kittens remain healthy, happy, and fully protected in any environment. Summary. Seasonal changes and regional differences play a significant role in the health of vaccinated kittens. Awareness of climate, parasite activity, travel risks, and local disease prevalence allows owners to adapt care practices and enhance the effectiveness of vaccines. By combining vaccination with proactive, seasonally informed holistic care, you ensure your kitten remains protected and thrives throughout the year, regardless of environmental challenges. Welcome to Chapter 15 of our Kitten Vaccination series. In this chapter, we will explore vaccine reactions, how to monitor your kitten after vaccination, and when it's crucial to seek veterinary assistance. Vaccines are highly effective and generally safe, but, like any medical intervention, they may occasionally cause side effects. Understanding what is normal, what is concerning, and how to respond ensures the health and safety of your kitten. 1. Common mild reactions. Most kittens experience mild, short-lived reactions after vaccination. These are generally harmless and resolve within 24 to 48 hours. Mild lethargy or sleepiness, slight fever, decreased appetite, localized swelling or tenderness at the injection site, sneezing or mild respiratory symptoms for intranasal vaccines. These mild reactions are signs that the immune system is responding appropriately to the vaccine. Monitoring at home is usually sufficient. 2. Monitoring after vaccination. After a vaccination, carefully observe your kitten for any changes. Behavior, reduced activity, hiding, or unusual vocalizations. Appetite and water intake. Monitor eating and drinking habits. Injection site. Check for swelling, redness, or tenderness. Respiratory signs, sneezing, coughing, or nasal discharge. Gastrointestinal symptoms, vomiting or diarrhea. Keep a daily log for at least 48 hours to track any mild or unusual symptoms. 3. When reactions become concerning. Some vaccine reactions, though rare, require immediate veterinary attention. Severe allergic reaction, anaphylaxis, facial swelling, difficulty breathing, collapse, or vomiting immediately after vaccination. High fever persisting beyond 24 hours. Persistent vomiting or diarrhea. Lethargy that worsens instead of improving. Lumps at the injection site that do not reduce in size after several days. Recognizing these warning signs ensures timely intervention and prevents serious complications. 4. Managing mild reactions at home. 4 mild reactions that are expected and temporary. Rest. Provide a quiet, comfortable space for recovery. Hydration. Ensure access to fresh water. Food. Offer small, frequent meals if appetite is reduced. Observation. Monitor symptoms closely for improvement over 24 to 48 hours. Most mild reactions resolve naturally without intervention. Avoid giving human medications unless directed by a veterinarian. 5. Severe reactions and veterinary intervention. If a severe reaction occurs, immediate veterinary care is essential. Transport. Use a secure carrier to safely transport your kitten. Emergency contacts. Have your veterinarian and emergency clinic phone numbers ready. Provide history, include vaccine type, date, and any prior reactions. Veterinary professionals may administer treatments such as antihistamines, fluids, or corticosteroids to stabilize the kitten. 6. Injection site reactions. Occasionally, kittens develop lumps or swelling at the injection site. Small, firm lumps, usually harmless, resolve within a few days. Large, painful, or persistent lumps should be evaluated by a veterinarian. Redness or warmth may indicate infection or inflammation. Proper monitoring and reporting to your veterinarian ensure early treatment if needed. 7. Multiple vaccines at once. Administering multiple vaccines in a single visit can sometimes increase the likelihood of mild reactions. Observe more closely for 24 to 48 hours. Schedule follow-up visits for boosters and additional vaccines. Discuss with your veterinarian whether spacing vaccines is appropriate for sensitive kittens. Balancing protection and safety is key to preventing unnecessary stress or reactions. 8. Rare reactions and long-term considerations. Although uncommon, some reactions require awareness. Autoimmune reactions, rare conditions where the immune system attacks the body. Chronic injection site lumps, sometimes persist longer and need monitoring. Vaccine-associated sarcomas, extremely rare but require veterinary evaluation. Being informed helps you respond quickly and ensures long-term health and safety. 9. Preventive measures to reduce reactions. To minimize the likelihood of vaccine reactions. Healthy kittens. Ensure the kitten is in good health before vaccination. Accurate dosing. Use weight-appropriate vaccine doses. Experienced veterinarians. Administer vaccines in controlled clinical settings. Record keeping. Maintain detailed vaccine and reaction logs. Preventive care supports safe vaccination and effective immunity. 10. Integrating vaccine awareness with holistic care. Monitoring for reactions complements other holistic health practices. Nutrition and hydration support immune function. Stress reduction improves recovery and reduces mild reactions. Regular veterinary checkups ensure overall health and early detection of any complications. By combining awareness of vaccine reactions with holistic care, you ensure your kitten remains healthy, protected, and thriving. Summary: vaccine reactions are usually mild and short-lived, but understanding the range of possible responses helps you act appropriately. Careful monitoring, home management of mild symptoms, and timely veterinary intervention for severe reactions ensure the safety of vaccinated kittens. Maintaining vaccination records, proactive preventive care, and a holistic approach supports long-term immunity, health, and peace of mind for both kittens and owners. Welcome to Chapter 16 of our Kitten Vaccination series. In this chapter, we will discuss the importance of tracking vaccination records and maintaining a complete health history for your kitten. Keeping accurate records ensures that vaccinations are up to date, enables quick response to health issues, and supports long-term wellness. Well-organized health documentation is especially crucial in multi-cat households, when traveling or during veterinary visits. 1. Why vaccination records matter. Vaccination records provide essential information. Proof of vaccination, required for boarding, travel, or adoption. Booster scheduling, ensures vaccines are administered on time. Emergency situations, allows veterinarians to quickly assess your kitten's immunity. Health history tracking, helps monitor prior reactions, illnesses, and treatments. Maintaining accurate records helps prevent missed vaccines and protects your kitten's health over its lifetime. 2. Essential components of a health record. A complete health record should include vaccine type, core and non-core vaccines administered, date of administration, exact dates for initial and booster doses, veterinarian details, clinic name, address, and contact information, kitten details, name, date of birth, breed, and microchip number if applicable. Reactions, notes on mild or severe reactions, if any. Organized records make tracking easier and support effective communication with your veterinarian. 3. Physical versus digital records. Both physical and digital records have advantages. Physical records, easy to carry to vet appointments, boarding facilities, or travel. Digital records, convenient backup, accessible from multiple devices, shareable with clinics or caregivers. Consider maintaining both formats to ensure records are never lost. Cloud storage or apps designed for pet health tracking are excellent options for digital backups. 4. Recording booster schedules. Vaccines often require boosters to maintain immunity. Core vaccines, feline viral rhinotracheitis, calicivirus, panleukopenia, and rabies. Non-core vaccines, feline leukemia, chlamydia, or bordetella depending on risk. Booster intervals, follow veterinarian recommendations, typically 3 to 4 weeks apart for kittens initially, then annual or triennial for adults. Accurate tracking ensures boosters are administered on schedule, keeping your kitten protected. 5. Tracking health history beyond vaccines. Health history should include more than vaccination records. Parasite prevention, flea, tick, and worm treatments with dates and types. Medical treatments, illnesses, medications, and surgeries. Behavior notes, observations on activity, appetite, or stress. Weight and growth monitoring helps detect early signs of health issues. Comprehensive health history supports preventive care and long-term wellness. 6. Organizing records for multiple cats. Multi-cat households require careful record keeping. Individual files, maintain separate records for each cat. Consistent format, use the same system for all cats to reduce confusion. Share with caregivers, anyone responsible for care should have access to records. Update regularly, include new vaccines, boosters, treatments, and observations. Proper organization ensures that every cat in the household receives timely care. 7. Using records during travel or boarding. Accurate vaccination and health records are essential for boarding facilities, proof of vaccination and parasite prevention, veterinary clinics, quick reference during emergencies or routine visits, travel compliance. Some states, countries, or airlines require official vaccination proof. Keeping well-organized records ensures smooth transitions and protects your kitten in all situations. 8. Monitoring and reporting reactions. Maintaining records helps track and communicate reactions. Mild reactions, note duration and severity for reference. Severe reactions, provide detailed descriptions to veterinarians. Future vaccination decisions, records guide spacing of boosters or alternative vaccines. Documentation improves safety and enables your veterinarian to tailor care. 9. Long-term benefits of record keeping. Maintaining detailed records provides long-term advantages. Health continuity, easier to transfer information when changing vets or locations. Prevent missed vaccines, avoid gaps in protection. Early detection, trend analysis may reveal emerging health concerns. Peace of mind, you always know your kitten's health status and needs. Consistent record keeping is a cornerstone of responsible pet ownership. 10. Tips for effective record maintenance. To maintain effective vaccination and health records. Set reminders, use phone alerts or apps for boosters and checkups. Update immediately, record vaccinations, treatments, or reactions as soon as they occur. Use clear labeling, date, type, and notes should be easy to read. Backup records, both digital and physical copies ensure no loss of information. These practices make managing your kitten's health simple and efficient. Summary. Tracking vaccination records and maintaining a detailed health history is essential for your kitten's well-being. Accurate documentation ensures timely boosters, guides veterinary care, facilitates travel or boarding, and provides a comprehensive view of your kitten's health. By combining diligent record-keeping with vaccination, parasite prevention, and holistic care, you ensure your kitten remains protected, healthy, and thriving throughout life. Welcome to Chapter 17 of our Kitten Vaccination series. In this chapter, we will discuss how to prepare for veterinary visits and communicate effectively with your veterinarian. Even vaccinated kittens benefit from regular checkups, preventive care, and professional guidance. Preparing for visits and maintaining clear communication ensures your kitten receives the best possible care and that you are fully informed about vaccinations, boosters, and overall health. 1. Importance of regular veterinary visits. Even fully vaccinated kittens need regular checkups for health monitoring, detecting illness early, even before symptoms appear. Vaccine administration, keeping core and non-core vaccines up to date. Parasite control, ensuring flea, tick, and worm prevention is current. Behavioral assessment, addressing stress, anxiety, or socialization concerns. Routine visits support long-term wellness and reinforce the protection provided by vaccines. 2. Preparing your kitten for a vet visit. Reducing stress during veterinary appointments improves cooperation and safety. Carrier familiarity, allow your kitten to explore and rest in the carrier at home. Comfort items, include a favorite blanket or toy. Calm handling, approach gently and speak softly during preparation. Timing, choose a time of day when your kitten is naturally calm or sleepy. Proper preparation reduces anxiety and makes the visit smoother for both you and your kitten. 3. Gathering health information. Before the appointment, collect relevant health information. Vaccination records, dates, types, and any reactions. Parasite control, flea, tick, and worm treatment history. Diet and nutrition, type of food, feeding schedule, and any supplements. Behavior observations, play habits, sleep patterns, and social interactions. Medical history, any past illnesses, surgeries, or chronic conditions. Organized records help the veterinarian make informed decisions and provide targeted care. 4. Questions to ask your veterinarian. Prepare a list of questions to maximize the benefit of the visit. Which vaccines are required now and in the future? Are any non-core vaccines recommended based on lifestyle or region? What parasite prevention schedule is best for my kitten? Are there nutritional recommendations to support immune health? What signs of illness should I monitor at home? How should I handle travel, outdoor exposure, or multi-cat environments? Asking questions ensures you understand your kitten's health needs and vaccination plan. 5. Observing your kitten's health at home. Keeping track of daily health observations enhances veterinary visits. Appetite and water intake. Energy levels and play behavior. Litter box habits. Weight and growth trends. Any unusual symptoms or behaviors. Sharing these observations with the veterinarian allows for proactive care and early detection of potential issues. 6. Understanding vaccine schedules. Vaccination schedules can be complex. Core vaccines, feline viral rhinotracheitis, calicivirus, panleukopenia, and rabies. Non-core vaccines, feline leukemia, chlamydia, bordetella, depending on lifestyle and risk. Booster timing, often every 3 to 4 weeks during kittenhood, then annually or triennially for adults. Your veterinarian can help tailor a schedule based on your kitten's age, health, and environment. 7. Addressing vaccine reactions with your vet. Discussing past reactions or concerns is crucial. Note any mild reactions, such as lethargy or mild swelling. Report severe reactions, including anaphylaxis or persistent lumps. Ask about spacing future vaccines to reduce risk of adverse reactions. Understand emergency protocols if a reaction occurs after a visit. Open communication ensures safety and informed decision-making. 8. Making the most of preventive care visits. Veterinary visits are an opportunity for more than vaccinations. Dental checks. Early dental care prevents long-term oral issues. Parasite screenings. Detect and treat intestinal worms or external parasites. Behavioral guidance. Advice on socialization, litter training, or anxiety. Nutritional counseling. Support immune health and growth. Maximizing the visit ensures comprehensive care beyond just vaccines. 9. Building a strong relationship with your veterinarian. A trusted veterinary relationship benefits your kitten's lifelong health. Regular checkups build familiarity and trust. Open communication helps address concerns promptly. Your veterinarian can provide personalized recommendations for your kitten's lifestyle and environment. Establishing trust reduces stress during visits for both kitten and owner. A positive partnership ensures your vaccinated kitten receives the best possible care throughout life. 10. Planning for future health needs. Veterinary visits help you anticipate long-term health needs. Vaccination boosters, keeping immunity current. Parasite prevention updates, adjusting based on seasonal and regional risks. Health screenings, blood work or imaging for early detection. Behavior and socialization planning, preventing future stress or anxiety. Proactive planning supports a healthy, well-protected, and thriving kitten. Summary. Preparing for veterinary visits and maintaining clear communication with your veterinarian is essential for maximizing your kitten's health and vaccine protection. Organized records, prepared questions, observation notes, and a strong relationship with your vet allow for tailored care, early detection of issues, and informed decisions. By integrating veterinary guidance with vaccination and holistic care, you ensure your kitten enjoys a long, healthy, and protected life.